really. Um, it's more anticipating some of the. We're going to start a violence prevention division within Human Services.
Yeah, 1, 2, 3, 4, 5, 6, 7, 8, 9.
I'll do the one on the end over here.
You already got this one?
Yeah,
Okay.
when you were just talking. 1, 2, 3, 4, 5, 6, 7, 8, 9. Good.
Fine, thank you. You're welcome. You said it's a Thuertas.
Good evening. I'm Mayor Ron Nirenberg with Bexar County Judge Nelson Wolff, and we're joined by Assistant City Manager Dr. Colleen Bridger, and this is our COVID-19 update for the San Antonio community. Tonight we're reporting 143 new cases of COVID-19, which brings our total to 44,265 in the community since the pandemic began. Our 7-day moving average of new cases, again, that way of tracking our progress, is currently at 157 new cases per day. Regarding deaths, unfortunately, we do have 20 new deaths to report tonight, which brings our total to 637 verified deaths in our community from COVID-19. These deaths occurred between June 23rd and August 13th. 10 of the deaths that we're reporting tonight are after reviewing death certificates provided by the state to Metro Health, which verified that the deaths were in fact COVID-19 related. We do have a number of deaths under investigation as we have been working through the state's report to us, and we will continue to update you those each night. Over in our hospitals tonight, we're reporting 569 people in the hospital, down 34 from yesterday. The total positive admissions rate is 15% now, which is a steady decline from the last couple of weeks. 57 new admissions to the hospitals for COVID-19 this evening, as well as 255, which is down 12 in the ICU, and 184, down 4 from yesterday, on ventilators. Those numbers are continuing to move in the right direction, not very quickly, but they are moving in the right direction, so keep up the hard work with regard to physical distancing, wearing a mask, and all the other protocols that our public health professionals have been reminding you about. We do have 55% of ventilator capacity available and 14% of staffed hospital beds available, so our hospital system remains under high stress. You'll note on the covid19.sanantonio.gov website that there is an indicator for schools. And as you know, Dr. Junda Wu, our public health authority, has issued directive recommendations on the safe opening of schools and where we need to be before in-person class is safe to happen. And you can see that we have a small improvement in the indicators we're monitoring for schools. Schools remain in the red zone, however, at risk, but the risk level has decreased slightly. At this time, in-person instruction is still not recommended. Services that do not involve prolonged close contact, and that is within 6 feet for 15 minutes or more, should be provided one-on-one to special needs students, at-risk students, and students who lack access to the online resources necessary for distance learning. Let me turn it over now to Judge Wolff.
Yeah, thanks, Mayor. The numbers are looking good. You know, we had 3 or 4 little goals ahead of us. One was to bring down the COVID infections and hospitalizations through the month of August. We're well on the road to doing that. You just need to continue to help us. We do have, 2 big points coming up. I would encourage everybody to be very careful over the holiday season. We want to do everything we can to not have people gather together over the holiday season and spread the disease. So we're going to really need your cooperation as we go through that, because after Labor Day, schools will in all likelihood start on September the 8th, and there'll be a number of students coming back to school. Inevitably, we'll probably have some problems, but we're going to be judged how well we're doing and how the schools operate, and I have confidence that they're going to do good. Now, we're also, in the Commissioners Court level, spending a lot of time planning for the November election. We know that's another spot that we all have to be careful about. We just approved today, given the instructions to the county manager, to move forward with whatever funding's necessary and bring that back to us next Tuesday to be able to do the mailing to some 250,000 people that are 65 and older, sending them an application for a ballot. We're going to pay the postage both ways. So those of you that are 65 and older, I would encourage you to keep your eye on the mail. We're going to try to get it done as early as possible because we know there's postal problems, and we hope to be able to take some action at least by next Tuesday to ensure that coming. So keep your eye on the mail. It may take 2 or 3 more weeks before we get it there. I would encourage you, if you get the application, to file for it and vote by mail rather than having to come out and go to the poll either in the early election spots or on election day. We have nailed down 3 out of the 4 huge sites that we will have in addition to others for early vote and for election day. We reached an agreement on the AT&T Center, the Alzavar Shrine location out by 1604, and we reached an agreement on the Concepcion Sports Park. We just need to land one more major large site, and that will be in District 2. We're making sure we have all the equipment that's necessary to protect the workers as well as people come to vote. And as you well know, we're prohibited from requiring a face mask. The governor did not agree with that. So there will be some people coming to vote that won't have the face mask. So you need to be careful. We also took action today to recognize the tremendous contributions which we've talked to you about before. What Kyle Coleman has done as the emergency manager for Bexar County. We decided today we named the fire marshal's building after him, so he will be remembered, and then we'll also have out there all the issues he dealt with over the last 20 years as he worked with us at Bexar County. So, Mayor, that's it.
Great. Thank you, Judge. A great way to honor a man who's spent so much time and gave so much to our community. So thank you for that. As a reminder, if you need assistance with rental assistance or any other service in our community, you can find information related to our COVID-19 relief at covid19.sanantonio.gov. Also, if you see a violation of the orders with masking or physical distancing in establishments, you can help us by calling in the number 210-207-SAPD. As always, you can get the latest by texting COSAGov to 55000 or check our website anytime at covid19.sanantonio.gov. Dr. Bridger, myself, and the judge are available for questions.
Dr. Bridger, how is Metro Health going to enforce schools posting the number of COVID-19 positives on their websites as part of the health directive?
The same way that we will enforce any other health order issued by the health authority. There's a process outlined that involves us going through the court. We don't want to get to that point. We think that we can just have conversations with folks and help them understand what we need and why we need it. But if we have to, we do have the authority under state law to go through the court system for enforcement.
Judge, you mentioned those 3 sites, the AT&T and these other 2 sites. What made these sites ideal for the elections process, especially during a pandemic?
Well, first of all, we do have the early vote, and we hope that we do the mail-in ballot, and we hope a lot of people will do that. We think that's really important. Second thing, if they're not going to do the mail-in ballot, those that are eligible to do it, and by the way, we're mailing to 65 and older, but if anybody else has a handicap or a health issue, they can also apply for the ballot and do a mail-in rather than coming to the poll. We decided to go with these 4 mega centers because they're large and we can spread it out, and we will have some people helping us. All the Spurs staff is going to be helping us when we have it out at the arena. The Alzavar is a really convenient location for everybody, as well as a large Concepcion Park. That was a building we built that can hold up to 6 basketball courts, so it's a huge one. So we have room to spread out. Now, we'll have those, and we'll have one more to go, but we'll also have probably another 40 or 50 early voting sites. So we prefer, if you can do it by mail, that's the best. If you want to go, we hope that you will do it in early voting. And then if you do it on election day, you need to remember, in any of this, you can vote anywhere you want to. But if we can get people coming and spreading them out so we don't have a big rush on election day, we think we'll have a lot better chance to control the virus.
Will there be staff from Metro Health or maybe from the city, additional staff to help out besides the elections office?
If it's in a city facility, there will definitely be city staff there. There are a lot of the early voting sites are in city facilities, and so we will absolutely have staff out there helping to remind people to wear their masks and stay 6 feet apart.
The other advantage we have, the schools are not going to have school that day. Most all of them aren't, so that's going to give us some sites there also.
In regards to elections and mail-in ballots and all of that, 4 sorting machines have been removed from the United States Postal Service distribution facilities here in San Antonio. Any comments on this issue here?
Yeah, I know there's 4 of them that have been taken out, and I know the local post office people have been saying that there could be some delay. So that's why we're trying to jumpstart this thing. We're still a little less than 2 months away from early voting. I think it starts October the 13th. So the reason we moved quicker today is so that the sooner we can get the applications in the mail, it gives the post office more time to return them and get them back to us. So that's why we're jumping out ahead. I would think if we get those in the mail in the next couple of weeks or so, there would be a long enough time for them to be able to handle it and get them back to us, so somebody doesn't have to bring them back to us on Election Day.
The Metro Health proposed budget for 2021 included more than $30 million additional dollars. I don't know if you all think that that's enough to address the cost of what coronavirus has caused in our community, at least from the Metro Health Department, or if there's more than just CARES funding needed.
The challenge with CARES funding is that the vast majority of it ends the end of December. So the big question in our minds right now is, do we have enough funding to go from January 1st through the end of this pandemic? And I think the answer to that is no. And we're very hopeful that the federal government will take whatever action is necessary to ensure that continued funds come to the local health departments that are on the front line responding to this pandemic.
There's a lot of preparation happening now because the numbers are slowing down. Is there any update on the refrigerated trucks or refrigerated storage at the medical examiner's office?
They are in place and available if needed. They are not needed right now.
Mayor, yesterday you mentioned about the team that will be going out to these different bars. Do you know how many members are part of this team? Will they be, and have they already been out?
I don't have an update on that right now, but I can get that for you. Obviously, they're going to be most important over the weekends, but I can get you an update on the specifics of it.
And those teams, will they be like shutting down places or just giving citations?
Well, they'll be going and inspecting proactively, and that might result in a citation. It may involve more than that. But as I said yesterday, it's not going to involve a whole lot of warning because we've already been down that road, and we don't think that's required anymore.
How many deaths are under investigation tonight?
265.
265.
With those 265, has it been difficult trying to go through each and every one of those?
It is fairly time-consuming to do the kind of investigation that we do to verify every single one of the deaths that is reported as a COVID death is legitimately a Bexar County resident that did die of COVID. So there's a lot of medical records review, a lot of phone calls, geocoding. So it's not as simple as just saying, oh, this death certificate says COVID, it goes in the box, check it as a COVID death. We literally check every single one of those.
Is there any update on the nursing homes tonight?
Nothing of significance to report.
Thank you.
Thank you.
Good night, everybody.